All right, we're back on the Overrun podcast. I'm here with Louis Imperatrice. He is the National Director of Clinical Excellence for DocGo. Lou, thanks for coming on.
Sure, no problem. I'm just going to correct you there. I'm national manager. The
National Manager. All
clinical excellence.
right.
A mutual colleague and a good friend of ours, Les Polk, is our national director.
Oh,
So.
okay. Yeah. Sorry, Les. That's my fault. So a couple minutes ago, I talked to Peter O'Mara about his paper in Paramedicine, and he talks about other programs, other countries having degree programs and a clinical ladder for paramedics. And Lou, you and I have talked about this plenty off air. You've written in GEMS a couple times about the progress that EMTs and paramedics have to make. You're involved in a very large United States EMS organization. And just to start, I'm wondering what your thoughts are on the presence or absence of a clinical ladder and how you feel about EMS workers getting degrees, master's degrees, and I guess where we're at and where we would ideally like to go.
So I think that the absence of a clinical ladder and the absence of undergraduate or graduate degrees in paramedicine is detrimental to our field. You look at most healthcare clinicians and professions, there is lateral upward movement. There's clinical ladders, whether it be through degree programs or through healthcare system-based training, et cetera, et cetera. There's movement up. But when it comes to EMS, what my take and my view is that you get your initial certification, say as an EMT, maybe you go to paramedic school, whether it be a associate's program or a technical program, and then you kind of plateau from there. And then we wonder why on a high level we're losing clinicians and we're losing professionals in this field, because once you become a paramedic, where do you go from there?
Nursing school.
You go to nursing school or you go to physician's assistant school,
right.
And you become a nurse and you work, as a clinical nurse, and then you go through the career ladder. You can get your bachelor's in nursing. You can then get your master's in nursing. You can go to nurse practitioner. You become a PA. You can become a specialized PA, and there's upward movement. And we kind of have a ceiling above us in EMS, which I think is just one of the major detriments to our profession.
And we certainly see, the average attrition rate is between 5 and 6 years, and there's a million variables that we can say that cause those things. I guess the principal question is this almost like an undercorrection, I guess, for EMS, where, we saw nurses and fire departments develop these ladders, and for EMS, because we saw people leaving the industry, we sort of correct to be like, just get out, just get your certification, just go out there, just go into the field. And we didn't really take the pains to adjust, like, all right, well, after they get into the field, then what?
Absolutely. So when we get into EMS, everybody loves it. I still practice clinically in the field as a per diem medic because I love it, but I got out of full-time practice in the field because there was nowhere for me to go. And it's a shame because I know so many great paramedics who struggle financially, socially, emotionally, because there's no place for them to go. And what can we do about it? Well, I can't go get a degree or a master's degree or a bachelor's degree to become an advanced practitioner. I can't go get a master's degree in EMS management to become a supervisor or a director or a manager. An MBA is great. Sure, go get your MBA, but we all know that EMS leadership is a whole different field than traditional business degrees.
Yep.
So we limit ourselves, really, in my opinion. And don't get me wrong, there's plenty of people who are very comfortable and they love being a paramedic and that's what they do. But there's a lot of people who, for their self-fulfillment, whether it be financially, just because they like to or just because they want to, they don't have anywhere to go. And then we see them leave the field and then it just comes full circle. So we keep asking ourselves, what can we do to keep people in the field? We'll give them sign-on bonuses, longevity bonuses, et cetera, but that's all temporary.
Right.
People want to feel fulfilled and not just fulfilled in taking care of a sick patient. They want to feel fulfilled in their career and use their skills. I mean, I know so many paramedics who their skill sets are just immense, but there's nowhere for them to go because they don't have that degree. They can't go into the healthcare system because I don't have a master's degree. They can't So they're limited. So I think we're our own worst enemy in this aspect.
And certainly, if you've seen, we've talked previously, if you've seen one EMF system, you've seen one EMS system.
Exactly.
And just the differences in the state we're in. We're both in New Jersey. Um, systems vary and change, and your neighboring town might be a fire department, which might be next to a town that's hospital based, which might be next to a town that's volunteer based, and all of that might be next to a state that has an entirely different system altogether. Um, so I think there's one of the problems is that, and Dr. O'Mara and I talked about this a couple minutes ago, where it's difficult to try to implement change into a system when the system is so fractionated as it is. Right. One of the things he mentioned in Australia is they kind of had a national program come along and say, this is how paramedics are going to be educated, and this is what their career ladder is going to be. And I wonder what your thoughts are on trying to implement a system like that at a state level, or is that something that has to start with federal intervention, or where can we start, I guess, whether it's with professional organizations like NAEMT or anyone else, to, if there's already documented recommendations out there to get bachelor's degrees, to get master's degrees, and we're already not doing it, right? How do we start, I guess, culturally making that shift where, NEMSAC is saying we should have bachelor's degrees and master's degrees. A lot of other places are encouraging additional education. We take the nursing model where they have career ladders. We take the fire model where they have continuing education and career ladders. So we have, it feels like we have rubrics for how to do it, and we have recommendations for how to do it, and we're just not. So aside from just, I don't want it to sound, like whinging or like bitching, but, it feels like if we have the tools to do it, is it is it a lack of will, or does it come down to we need to get the right people in place? Or to your mind, speaking as a manager of a large organization, I guess, how do we reduce that friction and kind of start moving everyone toward what would make the practice better?
So I think we have to kind of look at this from several prongs. So like you mentioned, EMS is where I'm at is private based, and the town next door to me may be fire department based. And that's all well and good. But if you look at it from a healthcare system, as a healthcare system, every hospital is different, but they're all the same. They all have a general similarity to how they run their system. Sure, there are their quirks and their nuances, but you go to a hospital in New Jersey, New York, Pennsylvania, Michigan, California, it's generally run the same. And I think that one of the biggest things is the lobby. Nursing unions, there's nursing lobby, there's federal lobby on the nursing level, there's federal funding for hospitals, there's federal funding for healthcare systems, state funding. We don't have that in EMS. We don't have a federal lobby. Sure, we have the NAEMT who lobbies, but there's no money like there is in nursing. There's no money like there is in the FMBA or the IAFF, these massive, almost billion-dollar lobbies. We don't have that. So we need money. We need federal money to, I don't want to say organize, but federal money to support this. We need leaders who are not old school boys club type leaders. We need modern day leadership in EMS who understand that we have to run this like a business, and a modern business. I wrote an article of EMS and its disconnect from modern day leadership. I mean, we still run EMS systems like the 70s and 80s.
Back in the good old days.
Exactly. And we need young, educated leaders who are educated specifically in this field. We need federal lobby, a big lobbying organization. And I don't want to use the U word, union, but and I don't think we need EMS union, but we need a significant lobby who has political clout, who can say, listen, Medicare reimbursement rates suck.
Right.
Attrition sucks. We need education. We need money for education, because I think every school should have some type of master's degree or bachelor's degree in EMS or emergency management, whatever you want to call it. But where's the money coming from?
Right.
We need money, we need lobby, and we need modern day leaders to emphasize education.
And I wonder, there's a couple programs that are out there that are certainly popular among EMS workers for degree programs, whether it's leadership, emergency management, and like that. And I feel like, this is anecdotal. I don't have program data in front of me, but it feels like a lot of the emergency management training programs seems to be more like a lot of mass casualty stuff, going through like FEMA and federal bureaucracy, which is important. But I don't know that. And I tend to agree that the reality is that medicine is a business. I think there's a divide between your standard business practice and what you see in EMS and what you see in medicine that I think needs to be kind of countered for. Like if you were a standard MBA, I'm not sure that going in to be an operations supervisor would be super effective for you. But I wonder if we're at a space where generationally we have hired managers who've hired managers who've hired managers who've hired managers, and kind of embrace that this is the way we've always done it thing, and haven't quite taken the pains to find people in positions or who have been trained for leadership. And the differences are subtle, and certainly you and I could go on for hours about how leadership education has failed. But to your mind, I guess I want to ask, what's that delineation between just managing, treading water, keeping everything afloat, and moving over to a more leadership minded type of practice?
So I think education is a big part of that and a start. But no matter what you learn in school, it takes being somebody who understands people and understanding how your decisions affect people's daily lives. We can't just look at our balance sheet and make every decision on our balance sheet because it's financially the best decision. We have to remember that these are people's lives we're dealing with, and a leader who understands that, this EMT who's working for me leaves here to go work another job, who leaves there to go work a third job just to put food on the table. What can I do
Right.
to make his life better? So it comes at the expense of a new ambulance that year because we spent the money on our people instead of spending the money on getting a new contract or buying new ambulances, et cetera, et cetera.
Yep.
It takes
mandatory overtime.
Exactly. It takes understanding people and understanding the individual needs of your people. I work for a company that has 7,000 employees, and I can honestly say that our CEO probably doesn't know every single one of them by name, but would take a phone call from me or any one of our field employees or anyone right now to his personal cell phone. And it takes that, where I worked for agencies where I had 150 employees and I had to schedule a meeting to have a 5-minute conversation with the director.
Yeah.
I mean, here I have a CEO of a almost $1 billion publicly traded company who would pick up the cell phone if I called him right now to ask him a question. And I think that's the big disconnect. Like you said, manager hires manager hires manager. What management experience does that person have where they were a good paramedic and they became a field supervisor
Yep.
who made sure everyone's shirt was tucked in and everybody did the exact thing they were supposed to do, and now they're a manager, versus the person who's a good medic but is loved by the staff. Maybe doesn't have the management experience, but we can send him to school to get that. We can send him to training to get that back-end management.
I think that's an important thing that I think is missed a lot too, because something that I tend to hear, at least again anecdotally, is I tend to hear that we can only hire who applies. And this is something that I've kind of railed against for years, because I tend to not think that's true. If you're in a position where you're making hiring decisions and you have 4 candidates in front of you and none of them particularly meet either the qualifications or the personality type you're looking for, you're under no obligation to hire that employee. Now, I don't know what the pressure is from up top. So like if you have a director or a CEO who's like, no, you will hire someone on Tuesday, I can understand that kind of disconnect. But I feel like a lot of it, like I said, it feels like treading water, right? Mm-hmm. Where, all right, a manager is left. We've got to put someone new into that position. and a lot of times I think people, and also staff has no idea what the pay differential is between management and staff, which is often like, $2 to $5 an hour. It's not,
it's nothing.
It's not like managers are living high on the hog.
Working an overtime shift a week as a field paramedic, you'll make more money than
probably make more than your supervisor. Exactly. Yeah, exactly. So I think that I hate simplifying it so much that, money talks and bullshit walks. But it feels like that's kind of the position that we're in, right? Where we want to hire these people. I think the industry does want to have leaders. They do want to have people who want to move the industry forward. It's just really difficult to do that if you're offering someone $65,000 a year to run a division that has, 1,000 employees. Aside from lobbying, I'm not sure how we generate the income for systems to be able to do that, and also convince the systems that it's a worthwhile pursuit. So I think we've spent the past, now in 2024, 50, 60 years kind of building this wall of separation between management and staff, and now we've realized, oh, this isn't the way to do it.
So I didn't mean to cut
no,
you off.
You're fine, go ahead.
One thing that I've always kind of lived by was that the highest level person in the room, the director, the CEO, the COO, whatever you want to call them, should be, and don't take this the wrong way, but should be the dumbest person in the room. Mm-hmm. That a great leader surrounds themselves with people who are smarter than them, because I'm not a subject matter in every field or everything, right, but I surround myself with subject matter experts in the room so that when there's something comes up, I defer to them. So like the model that we use here is we have several of our EMS markets across the country where the business leaders have zero EMS experience whatsoever, but they've all run successful businesses. Yep. And they have zero input into the operation of the EMS system. They're all highly educated businessmen, and they have directors of operations, managers of operations who make those decisions for them. And I think that's where we failed in EMS, is that we just promote ourselves up through the ranks, medic, supervisor, coordinator, manager, director. What business experience does that person have? Right. What experience do they have to they may be a great field operations supervisor or a field operations director, but they don't know the difference between top line revenue and EBITDA at the end of the day.
And that's ignoring the reality that EMS is often a loss leader for every organization.
And that goes right back into the point why it is so important that we need high level education in our field. And I think it should be two-pronged. There should be two tracks of education in EMS. The clinical education, because there's people who just don't want to deal with the bullshit of leadership and they just want to expand their clinical scope. We can keep people out of the hospital by having advanced practice paramedics who are doing mobile health visits, who are doing care gap closures, who are doing all of that. But a regular, I don't want to say run-of-the-mill paramedic is not trained or educated to do that. So there's that track. And then there's the management track where you learn the nuances of this specific industry to become a leader in this industry. I think that's where we have failed, is just promoting up through the ranks instead of going out and finding the experts that we need. You don't need to be a paramedic or, to run a successful EMS agency. Do you need to be a great paramedic to be a successful operations manager? Absolutely. Do you need to be a great paramedic or even a paramedic at all or an EMT at all to run a successful business? No. And that's where we failed, in my opinion.
And I think it's interesting to have someone to come in and kind of call balls and strikes and then, I've noticed this deficiency. How do we fix it? And then talk to the industry people. I think that's an interesting approach. And I certainly we've talked that in the industry we often don't know what we're doing, but as far as trying to improve the EMS industry is concerned, when it comes to leadership and management, career ladders, and all that, I feel like the common refrain that I hear from people is that we can't do it because it's hard, and to that I say anything worth doing rarely is easy. So Louis Imperatrice from DocGo, thank you so much for your input